Okay, will y'all stand for the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States, one nation, under God, indivisible, with liberty and justice for all. Thank you all. We don't have a very long agenda this morning, even though we've been gone, but we want to take care of business, whatever that may be. So the first thing is, Michael, you have a lease agreement from the prosecutor's office.
That's correct, Commissioner. The Gordon Flesh Company, the successor and interest in cannabis equipment, has provided copier equipment to the Victims Assistance Office of the Vigo County Prosecutor's Office, and there is a lease here for that, $92.25 per month, in the name of the Victims Assistance Director, Jessica Wood.
Okay.
If you have any questions about that, I'd be happy to try and answer them.
You have any questions, Brendan?
No, we've already signed it.
Oh, you have, okay. I still can't get used to the name instead of IBE.
Yeah.
Takes me a second.
Yeah,
Yes.
it's tricky.
Motion to approve?
Second.
No, I'm saying you're making
Oh,
a
yeah,
motion to approve.
motion to approve.
Thank you. I'll second. All in favor?
Aye.
Aye.
Thank you.
Okay, and the next one is our financial agreement with UMR.
That's correct. You had a meeting recently with Jason Lester from Sycamore Shin, schedule of benefits, the annual out-of-pocket participating pharmacy retail rates, generic drug rates. There were two modifications to this plan. The first being that diabetic testing strips will now be available at no cost to the employees who are on the plan. And in the COVID-19 pandemic, you have agreed to waive the deductible for telemedicine up and until January 20th, 2021, but may be further extended after evaluation of the COVID-19 emergency situation. And Sycamore Insurance is also in the process of developing an addendum to this to provide for mental health counseling for no cost during the COVID-19 public health emergency. That, as I said, has not yet been developed, but it was discussed at the meeting. And I know the commissioners felt strongly about that. And yeah, if there's anything anybody else wants to add, or any questions, I'm happy to try and answer them.
So we can go ahead and approve this today and with that addendum added in.
Well, yeah, there will be another document coming down the
Okay,
pipeline
that's what my
confirming
question.
that in writing for them. But
Okay.
as I said, it was discussed at the meeting, and it is being developed.
Okay. Need a motion to approve?
Yeah, just to reiterate, we're doing this to help the employees out and encourage treatment and use the use of the prescription supplies because we want to keep our employees as healthy as possible. This is kind of an above and beyond measure, but I'll make a motion to go ahead and move forward with the amendments to the plan.
I'll second. All in favor?
Aye.
Aye.
That was all I had.
Okay. Jim, we have the minutes and the claims. You're on.
Many minutes. Let's see, we got November 10th minutes to approve.
I didn't have any questions.
and I don't have my calendar. I didn't look it up to see. I just read the body. I don't know if I was here or
Yeah,
not.
you and Brendan.
It's me and okay.
Brad was
It
there.
was the Brendan and Judy show.
Okay, Brendan and Judy show. All right.
And just in case anybody was wondering, Brad is still alive.
Yeah, we saw him last night.
We saw him yesterday.
That's good. Yesterday evening.
Yeah, he's been working from home, recuperating, so
Okay, we need a motion for the minutes.
I will make a motion to approve the minutes from November 10th, 2020.
And I will second that. All in favor? Aye.
Aye.
Okay.
We've got, 3 weeks worth of claims. You wanna do them separate or all one batch?
Let's do them separate. I just,
Okay, we got November 7th through the 13th for $3,769,634.68 and payroll of $1,010,800.42 for a total of $4,780,435.10.
do you have any questions on any of those?
I don't, curiosity, are you seeing a trend with the local income tax? Are we seeing numbers down from what we
Well,
anticipated?
no, it's fixed at the end of the year. It remains steady.
Okay, so the distribution is going to be consistent, but
It hasn't, no, it,
I know
and-
you and Cheryl have been sitting on so many different meetings. Are they saying anything? What's
See,
the latest
when-
prediction?
well, we got our certified numbers a week or so ago. I can get them for you. I don't really have it on the top of my head.
No,
but
I'm
we're
just
not-
curious.
If we do see a reduction in income tax distributions, it'll be for 2022.
Really?
Yeah, that's the year.
Because here's, all right, the distributions that we're getting now are based on 2018 tax returns. The distributions that we will receive next year are based on the returns that were filed for
2020.
April 15th, 2020 for 2019. So they weren't seeing the effects of any reduction in income. But next year, when tax returns are filed for 2020, there's, possible reduction of people's income.
So 2022 maybe our year.
Yeah.
That's the one their state's predicting, this 2022,
For local income taxes,
Mhm.
for the distributions.
on everything that they're questioning. A lot of it is based on that, but the local, yeah, everybody's talking about it.
But our road revenue surprised everybody though, that they thought there was going to be down, but it's really,
It was hit for a little bit, but
people are still buying cars.
still buying
Registering
cars,
vehicles.
still driving.
Yeah.
And, food and beverage,
Right.
it took a hit for 2 months and back to,
Well, the
Stronger
carryout
than
thing
normal,
is a
yeah.
big deal.
In food and beverage, we don't have to wait for that 2-year lag time.
no,
It comes in.
comes in as they collect it.
So intriguing. Can I make a motion to approve? Or did I already do that?
I don't think you did, but go
Make
ahead
a
and do
motion
it
to approve
again.
them claims November 7th, November 13th.
Then we
Okay.
got November 14th through 20th in the amount of $1,490,455.42.
Should we go ahead and vote on the last one now?
Pardon me?
Did you vote on it?
We didn't vote on it.
Oh, vote on it.
We didn't. I said all in favor.
Oh,
Aye.
did you? Aye. Okay, now we're good.
Okay,
November 14th to 20th, $1,490,455.42.
I had no questions on that one.
Make a motion to approve.
I'll second. All in favor?
Aye.
Aye.
And November 21st to 27th in the amount of $2,053,619.11 plus payroll of $1,059,107.19 for a total of $3,112,726.30.
There again, everybody got paid. I had no questions.
Make a motion to approve.
I'll second. All in favor?
Aye.
Aye. Okay. We have any comments? Brendan, you got anything?
No, just, you and I met with the health department yesterday for a little bit, thinking about ways to make COVID go away, and we're just doing what we can. The health department's doing a great job. Contact tracers are behind, just like everybody else, but I think we've got 20 people working cases, and we expect to see huge numbers in the next few days.
Can you find more of them?
Can we find more? We probably need to look at that, but that's,
I asked the health department when they called me and told me, I was quarantined and had to be tested and was okay. But anyway, I talked to them at that time because they were so far behind on the tracing. And they said no, that they were struggling to keep people and find people. And so therefore they turned over a certain age group back to the state. So if you fall between that age group and what was that? Between
I forget, it's basically
there-
19 to 50 something years old.
19 to 50 age group has been turned back over to the state for tracing.
Well,
They're doing everything else.
which brings me to this Safety Awareness CARES Act funding. We have
The $300,000.
348,000.
So we actually talked about that yesterday
Yeah.
for the commercials and advertising and stuff, and yeah, but
Well, I checked with IFA, can we pay the contact tracers with us? And they said they believe so.
really,
So I've got about $130,000 worth of contact tracers that we didn't claim in the previous batch. The payments we made for July, August, September, October, and about halfway through November, that amounts to about 130,000. So I can get 130,000 of this out,
That'd be
plus
great.
the remainder of whatever we pay for the rest of the year. AIC, we could, I think it'd be worthwhile to go buy some TV time.
They did approve the radio time, the AIC did,
yeah.
because when I
Well, they're buying it on. They bought some spots on.
I know, we went back and forth on it, and, some people on the board thought that it was like a panic thing, the mock-up that they did.
I think we need to make it fashionable.
Yeah,
These ad agencies can sell anything. They could sell a mask and
yeah,
make it look sexy.
Well, as we've had many conversations about this, people are protecting themselves. There's an element that's not, and we're seeing cases rise. But Vigo is consistent with the other counties. It's rising across the state. So all the messaging in the world, we can send it out ad nauseum, but as we do it, will it change people's behavior?
A good ad campaign can change people's behavior.
Okay, well, I'm looking forward to
That's
what you
what
come
it's
up
all-
with.
we don't have a
On
Dr.
an
Fauci.
Yeah, Jim, I did mine on top of the courthouse, so we'll see what you can do, Jim, and then we'll get that out there.
You gotta hire the people that know how to write the
Right.
things.
And
I'm
put
a
the right
numbers-
people in front of the
yeah.
camera.
You missed
know?
mine?
Or I forgot this is radio.
No, it's radio and TV.
They've got a TV.
We have-
spot.
there's
They
a
have
TV. Yeah, the TV spot's already done, and we can choose whether or not to put Vigo County Commissioners at the end. But it's already done, because it's been airing in Marion County, and it's been airing in the Donut area.
Well, I knew they had, but I didn't know that we could get
They
that
sent-
part of it.
yeah,
I didn't
They sent it to us.
Have you seen it? I've got it.
Yeah, I've seen it.
Yeah, Yeah, I've seen that, but I just didn't know that that was available to us.
But
I
do you
thought
wanna
all we
look
could
at-
get-
Buying some time on local TV stations or something like that?
If you're confident that we're gonna get reimbursed for it, then I'd say we move forward with it. It's not gonna hurt by any means, but, you know, they sent that to us on Wednesday.
The,
They said, you've got to knock this out immediately.
got till December
That this is December 1st.
Got till 21st,
till the 31st.
31st,
Yeah.
end of the year.
And they
Okay.
want, well, I was starting to send in a claim for those contact tracers yesterday and then got reading the rules and they only want one claim for the whole batch, so I guess be
If we was gonna
spending
do
New
this,
Year's
we'd have
Eve
to
writing
wait.
a claim for whatever it can come up with.
Well, you know, that money is for education.
Yeah,
And the contact tracers, every time that they call,
they're educated.
they are educating. They're saying, hey, this is what you need to do. So yeah, I mean, it's different than a little PSA, but they are doing the direct contact. So I'm glad that this is good to hear.
Yeah, we can call an ad agency or TV station or somebody and say, hey, what can you do for us? I mean, if there's $100,000 left over, you can buy every spot available in this market, I
Right.
would guess, for the rest of December.
Just
But-
like any other allotted money, if you don't use it, they give it to somebody else, so that's the general rule.
They leave it up to you.
Yeah.
The way that it's just it. I haven't even thought of
I don't
that.
know. Yeah, I was gonna say.
What are you thinking?
Because we haven't talked to it.
I stopped. I don't watch it anymore. You know, the conversation this morning with Nancy and I was, you know, something about on the news last night, and I told her I quit watching local news. As much as I hate to say that, because my friends at the stations that are watching us right now are probably cringing, but I quit for my own mental health, for one thing. But here's a perfect example, though. If you do something that's somewhat realistic, scary, and Judy knows the one I'm talking about, the video that Joni and I did, which was 100% factual. There's 90% of the feedback that I got was people liked it. 10% was, why are you stoking fear? Why are you creating panic? My thought is, no, we're just telling you how it is. This is reality. People don't want to hear that. But that video was viewed 35, 40,000 times. The positive thank you message that they did on top of the courthouse was viewed less than 1,000 times because nobody shared it. Nobody shared it because the boogeyman wasn't in there. If you make it kind of scary, they pay attention to it. But then again, you're also going to get that negative feedback too. So that's why I'm cautious, or not really cautious about it. That's why I'm not so excited about it. As a person who enjoys being on camera all the time, shocking, I don't want to see us overdo this because we cheapen the message. You know, when the message hits the media tomorrow that we're red, and I don't know that we're going to be red, but I'm pretty confident we're going to be red next Wednesday or the following Wednesday. It's going to be a game changer. People may pay more attention, but the problem is they're paying attention to the situation after we already got there. You know, we had the discussion yesterday about whether we should start clamping stuff down. I still don't want to do it. Judy, I kind of forget where I'm not going to answer for you, but
This is money that will pay for enforcement of that lockdowns too.
But enforcement, that's what the whole discussion was. What can we enforce?
Yeah, I mean, there's definitely procedures in place to put capabilities on declarations related to the public health emergency made by those officials, you know, authorized to do it. I mean, in declared public health emergency, the local health officer that every county in the state has by statute is authorized to impose conditions that are consistent with protecting and promoting public health. The state also has those capabilities, and at times during this public health emergency, they've exercised them, and everybody, I think, wants to see people try and protect themselves to the best of their capabilities, and but at the same time, appreciate that it's a invisible virus that is very very contagious. So the powers are a bit bifurcated to ensure that if you want a public health officer with punitive measures, that the executive arm of local government has consented to that finding and believes that violation of that public health order should be punished. So it's not, the separation of power doctrine is something they appear to have thought about in that context.
So it would still have to be the health department
It
who would
do.
cite these people. We have to put in place a punishment, so to speak. That's basically right.
Yeah,
Okay.
Dr. Brucken could put capacity restrictions on local businesses that the health department has jurisdiction over. And the commissioners could pass an ordinance establishing a punishment for a violation of that public health order. There's definitely a process to do that. It's, but as we were talking about, so much of what you learn from the testing, it's all reactionary. It's all, you're playing, you're trying to make decisions based on data that's a week old or 2 weeks old. And so, it's just a policy decision that needs to be fully vetted, and
And I don't know that during this time, is the Board of Health still following a schedule of going to restaurants and bars and all those places? Are they still?
they're still inspecting.
Yeah, the inspections continue, and it's kind of unique, Judy, that they can actually enforce non-mask wearing compliance at food establishments that they inspect.
Oh, yeah.
But they can't go into a store that doesn't have a food establishment and enforce the masking. So we met yesterday about this, about tightening things up and doing the enforcement, as Jim mentioned, what our options are. But as I sit in the contact tracing meetings, last week we were wrapping up the cases that were traced to Halloween activities. What we're going to see now are the cases attributed to Thanksgiving activities, gatherings, social events. So that'll be the next 2 weeks. Then you may have a lull, then you're going to have your post-Christmas activity. So it is, are we chasing, how do we get ahead? And we can do all the messaging in the world that says, hey, don't have big gatherings, and what are people still going to do?
Well, I
Have
guess
big
what
gatherings.
but I guess what I'm getting at is we can pass any ordinance and all these things that the health department needs, but the key word is enforcement. Who's going to go out there? I mean, the Board of Health they're the reporting agency. And do they have the people to go out there at night and see how many people's in those bars and in those restaurants
Well,
and count those things? Who does
What
that?
I mean, ordinances are just local laws. they can be enforced by local law enforcement. The sheriff's office,
They can.
they can't.
Okay, I was
on-
under the
on a-
impression that they couldn't.
No,
No, they
Okay.
can't.
they can. They can absolutely enforce. I mean, they do, with the dog ordinance. They do that already. It's just, it's a different context and a different factual scenario. But
Okay.
no, the sheriff's office can enforce.
I just didn't
Those-
want to put,
And-
right,
and I'm not-
make
yeah.
another ordinance that it's nothing but words on paper. If we're not-
I think there is definitely a means by which it can be accomplished. It is very complicated and it involves several layers, but it's a it's just a matter of whether from a policy level it's better to try and promote kind of self reliance or
Self-enforcement.
that
Yeah.
it's in your family's best interest to not get together for that risk. So
So you and Joni, Dr. Brecken are working on that
we
together to see what.
I started working on something based
Good.
on that meeting yesterday, and
Okay.
yeah, I will follow up with them and with you.
Okay.
There are a couple counties in the state that have done this where they've levied fines from $5 to $50. Like if they go into a convenience store and people aren't wearing their masks and they cite them and fine them. We can easily do that. And it sounds like from what Jim's saying that there's money available to pay for those.
Through the end of December.
Yeah. To pay for the overtime maybe, or hiring a person or two people to do it. And it's just, it's such an odd time and an odd thing to even think about,
I agree with that.
I was looking more for quality of life projects. Now we're dealing with keeping people alive projects. And it, where we're seeing trends and, people get upset with us because we're not telling where the hot zones are. And then when we say where they are, they get mad at us. So I'll just tell you right now, don't go bowling. As silly as it sounds, the last few days, so many cases have been attributed to bowling. And you think about it, people are using the balls, they're touching stuff, they're not wearing their masks, they're cheering, they're probably eating and drinking, and we're seeing cases now tied to bowling. So, do we go after the bowlers? No. But the health department is working with certain bowling alleys to say, hey, look, this is what's going on. You may need to step up measures. But that's a new thing. Remember when we were dealing with pool leagues? Well, that was an issue a month ago, and I think there's actually a fatality.
And you know what, really is, one of probably the worst spots in the world, and I got this on my mind and I think about it every time I go into a grocery store. Do you have any idea how many people handle that can of peas?
Can of what?
A can of peas, a can of
Oh.
corn, whatever it is,
Sure.
a loaf of bread. How many people before you have handled that? And, you're wearing your mask, you're all these things. Maybe you wear gloves. Sometimes I do, sometimes I don't, depending on what I'm shopping for. And then we take it home, and unless you're very diligent and wash everything down, you put it away and then you use it. I mean, it's just a scary thing. It's everywhere. And, I don't care how scary the message is, it needs to be out. Okay, you got anything else?
Talking about shortage of contact tracers, how are they going about recruiting these people?
I don't know. That was
What
Joni
about-
and them
what
do
about
that.
like go to a temp agency?
So,
I don't know how they're doing that, Jim,
well,
but
one of the things that they have done is that employees have been cross-trained recently on contact tracing. So nurses, for example, they've actually slowed down a lot of their services in health department. So these are doing contact tracing now. And Joni knows that she could reach out to several departments here that if they have an employee that may not be as busy right now, that they could be put in the contact tracing pool. So she has been creative. The health department has been creative on getting more tracers. But as Judy noted earlier, keeping the full-time ones is the challenge. And they're not working Monday through Friday. They're working 7 days a week because the cases hit hard every day. Some of them mentioned that they're actually making calls on Thanksgiving Day.
How about, but what I was gonna suggest, could they hire people through, you know, employment agencies?
Sure.
Temp? I mean, how much skill level does it take to make a phone call and read a statement or
It's so
whatever?
much more than that because you're dealing with people that get that phone call and they're scared to death. And you need to have a compassionate, empathetic person on that phone line that's going to be able to go past that script, that's going to be able to talk to them about their situation. If you were just to read a script and hang up, that the contact tracer has not done their job. They need to, the weird thing is, as we have people in this room, a lot of people in this room have been contacted by the contact tracers. Some people in this room have even have been COVID positive. So they've dealt with this. They'd be the ones that give you the best feedback about tracers and how they handle the case. If you don't have that right person in there, it could really make or break how it moves forward. So it's not just getting somebody that can read a script. It's getting the right person. And they've had people do contact tracing that just simply didn't work out.
Well, that's Joni's thing, so we'll let Joni take care of that.
You want to
Have
do
anything
it?
else?
No? You're not going to volunteer for it? No?
I got a question. We don't have too many out there, but how are you handling your appointments? When you make an appointment, does John here at the door know who that person is that's coming to the door? Anybody can walk up that door and say, hey, I got an appointment. I want to see Nancy and I've got an appointment. He don't know the difference whether they do or not. So who's walking in here? Stacy?
They make an appointment in my office, I got them. They'll still come to work, and I got them, I have to call them.
You know, I don't know if it's done, I think it's happened from here, because when they get in the first lot,
They call you when they're here.
they call me or one of my staff, and we have to go out and put them to make sure mask for doing. And we bring
Okay, my next question is, when you do that and you make that appointment, what information do you have about that person? I mean, I'm sure you have maybe an address, a phone number.
No, I do not. Like, they make an appointment, practice number, waited on.
Well, I think that's a practice we should do. If somebody comes up with COVID and has to have the tracing thing, you know, I just think it's a good idea to have all the information about your appointments that you can get. That's just it's not a rule, it's just a me thing, you know, just like you said. Huh? Okay. Okey doke, that's
So does
good.
the auditor says that too.
Okay, you don't have just the public coming in.
No, and if I do, it's very, totally, they're doing stuff online.
Okay. I'm just curious how that was working.
Bible searches that took Stacy on to us. We only had, I think, last month,
That's great.
because we handle everything.
Yeah.
Guys,
Okay.
keep pushing this platform, keep on hearing. We handle as many as we can informally through, and phone conversation. And if you've got maybe another person that are outstanding, still a good number. Those are ones that we can't handle until we have here. I don't see that happening until first of next year, right?
Yeah, we don't have a clue when that's gonna happen, but the way it is now especially.
I guess a possibility, I don't know how people want to do with that. I know some of our people aren't gonna sit there and get pictures, see me, I can. So we may not
Well, if it's a Zoom meeting, I mean, and they're not paying attention. Maybe we need new board members. That's their job, getting paid to do it. Oh, well, that was just curiosity. You got anything else? Anybody have anything?
Calista?
Oh, I forgot Calista did say.
I have the annual certification of elected officials, that's to be made to the Vigo County Board of Commissioners for both, disclosure of county contracts and nepotism.
Oh, yeah.
These were signed by each of the council members earlier in November, and I'm presenting them to you as a matter of record, so.
Thank
Okay.
you.
Just give it to Karen, if you would.
Huh?
Okay, yeah,
Oh,
Tammy's fine.
okay.
And then Jim, do we need to do one also?
You do,
Okay,
by the end of the year.
by the end of the year?
We always do that.
You only have to do the,
I think you need to file them with the conflict of interest. You need to file with the clerk also.
no. Yeah, it's just. The nepotism and the, basically, if you have any contracts with the county, then you have to disclose.
Thank you, Calista.
Okay, anybody else have anything? Yeah, Kevin?
Yep. No. What are they for?
Well, we just keep one mask in focus so that if you want this complaint, they can ask to make sure they got one.
Yep. We'll give you a box.
I given me one mask just
Yeah.
Anything else? If not, we're done for today. Thank you for coming. Oh, Cheryl? Do I?
So we have 3.1 million, is that right? Can we have a discussion this week, before the week's over, to line out a plan of attack on what we need to do to get everything paid before the end of the year, and what we have available to pay? Okay. All the CARES Act expenses? Okay, but, okay, refresh my memory, Michael. We did that ordinance so that when this time comes, we can just approve it. Is that right or wrong?
You did the ordinance so that when the money came in, it went into the general fund.
Okay.
And was subject to the normal appropriation process.
So the council would have to approve it. So we need to have this wrapped up before the 7th.
I think what she will do is,
We,
No, the council meeting's the 7th.
oh, I thought it was the 8th.
8th? I don't know.
Right.
Okay, so they'll make the appropriation for the receipt of the funds, and then that'll allow us to approve.
They'll make the appropriation to allow you to spend.
Okay,
But it's already been spent.
okay, so since we're having a discussion about this, and it, I guess it's appropriate to do it now. The jail, it's great news. The jail yesterday said, hey, we want a new type of breathalyzer machine that'll protect the employee from when the person breathes into it, it doesn't expose the employee. It's a new COVID safer device. It's $2,000.
it's like a stovepipe that goes up instead of out towards them.
So my thought was, this process was, yes, go ahead and buy it, and then we'll approve it with, we'll pay for it with that balance. Is that correct? Okay. I told him to go ahead and order it, so. But then like the EMA signs that we were talking about, so will that be the commissioner's discretion or the council's discretion? Well, I don't remember. Right. Okay.
Appropriation there by the council. They want to have it fire.
Okay. So it does, yeah. And then, so Tammy, can we get that set up maybe for Wednesday or Thursday? And then Calista, you gonna be part of that too? Do you need to be part of that meeting? Do you think so? No? If it's not necessary, we'll figure that out. We'll have Tammy set a meeting up and then to figure out what our strategy is. Because we want to make sure all that money's spent.
So
Right.
who are you
You don't
talking
have-
about setting up a meeting? Could I be included in this?
Oh, no, it's the commissioners.
I mean, I don't know what you're talking about, to be honest with you, and that's my fault for being out last week, I guess, but, I'd kind of like to know.
No, we're just to have
EMA.
a discussion as far as what we have available to us, and then what we need to do to pay things to move forward. We have a lot of departments that want to buy COVID-related items, but we've kind of said, hey, stop doing this because we don't know if we're getting any money. Now we have that money.
What's the balance left?
Right. And then with Jim's good news of possibly being able to cover the contact tracers through this other fund. So we did this, was it last week we all met, just to kind of have a little brainstorm session?
Yes.
We'll just kind of let's just set that up again without just us. We shouldn't need to be there for this one, I don't think, no. Yep. Unless you want to invite her, hell, everybody's welcome.
Public meeting.
What would she have to do with any of it that we would need to have her?
Oh, I think they were just kind of making a funny that it's not necessary.
Okay. Anybody else have anything? If not, thank you for coming.
Don't have to. Yes. Oh, yeah, it'll be tomorrow.
All right.
Hey, Nance, how's Josie doing?